Okay.
My name is Dr. Dorothy Gain. I have a license, a doctorate in family counseling, and my license is a marriage and family therapist. I am also a forensic expert and a child custody evaluator, and believe it or not, I am now become a victim of elder abuse. I have represented people and helped them all in situations through our court system which needs to be changed. I am now a victim and in jeopardy where they are saying now that my husband needs to be taken away from me and put in long-term care. I have taken care of my husband for over 40 years, and I will show you later that he is well and thriving with the TLC that I give him. According to a nurse, an RN, she claims that I am neglectful of him because I had difficulty with a meniscus, a torn meniscus, which is a very slightly torn meniscus and has been helped. And I want you to know that I was a former dancer, a professional dancer, many years ago, and I dance now for my own entertainment and my own exercise. I work out daily, and just to show you, I'm going to dance a little bit. That's my tap dancing, and I can do more, but I don't want to bore you. I just want you to know I'm a live and active female, and I take care of my husband every day. So now, this lady sent a social worker to my home. She called Medicare, which I have to help me with a MRSA illness that he has that I am trained to do. I have a background in medicine. I'm not an RN, but I am certified by the Veterans Administration as a skilled nurse, and I've had many years of experience in that field, having worked in 1st Army Headquarters as a first assistant scrub nurse. I worked on bilateral fractures, and I worked on carcinoma, the reduction of carcinoma of the mandible. I have been trained again, as I said, with the Thousand Oaks Los Robles Hospital in the care of MRSA, which my husband unfortunately has. The reason this nurse came into my home is that she was hired to come in and evaluate him, and she decided he needed what we call a wound vac. The wound vac was put in place through Medicare, which I have a copay of over $400, not complaining, only explaining. She came into my home, and I helped her with the meniscus that was torn. And it was very difficult because my husband's a quadriplegic, and it's very difficult to hold him up in position. He's dead weight. But I did it. I moved him, and I turned him, and I took care of him. And she laid down the track. Well, guess what? With her RN, the track fell out. Okay? It didn't work. I called the agency, and her name, by the way, please remember the name. Anybody watching this video, remember that name and watch out for that nurse, because I was told she does this, and I will not mention the name of the professional that said that. Okay? They said she's used to coming in the home and doing this, and her name is Sharon Dianella. Sharon Dianella, and she lives in Newbury Park. And the agency that supported her is Help Unlimited, and they are located in Ventura. And when I called them to tell them what was happening, they didn't want to know nothing. They supported her because she wanted to come when I had no caregivers to help me. I have caregivers 7 days a week. So I simply asked, even though I helped her that first week myself, could she please come when I have caregivers? And with that, the jaw tightened up, this whole jaw, the whole zygomatic arch with anger. But she's very cool and calm. And she said, I'm going to put him in a long-term institution. She told me that when I was going out to my car. What caregiver does that? She did not sit me down and have a discussion and talk to me about this. This is cruel and abusive. And we need to stop this kind of treatment of the elderly. And we need to stop this treatment for the children as well. Because myself, as a child custody evaluator, I have seen children yanked out of the homes and judges sign it. Judges are not trained to make that decision, and they stamp it. They rubber stamp the report made by those caregivers. This law needs to be changed in Congress. Any nurse coming in there to make that statement should have a doctor to support her. She's a nurse. She's not a medical doctor. So I want anybody listening to this video, please send me donations. I'm gonna hire an attorney. I want to sue her, Sharon Dianella, Newbury Park, RN, and I want to sue the agency, Help Unlimited in Ventura County, for allowing this abuse to happen. And the joke is that the wound vac they put down, it fell out. It fell out twice over the weekend, and they left him there. They sent me a nurse that came in, did not wash her hands, took her dirty bag that she carried from a car and put it on top of the table where his medical supplies were. She spent an hour and a half attempting to put this track down and failed. And then she blamed the equipment and said it was broken. Now my husband has a MASA wound, which is quite large and deep, and she took her dirty hands and took a gauze and shoved it in there and left. Fortunately, I am trained in sterile techniques and trained in MARSA, once again by Los Robles Hospital wound specialist. I took care of it and made sure that he was properly taken care of for the damage that she could have done. That's what Help Unlimited sent me. Now, since she's gone, she called Medicare to stop my service, which I am paying a $400 copay. She called them and complained on me. I am fortunate enough to have the support of the wound care doctor that said he will come and supervise me, that I know how to do this, and I want to show you guys in this video later on, who's ever watching this tape, that that machine is working fine. Okay? I laid down the track, and it is working fine. So I say, all of you victims of elder abuse, if you're in the home and you're taking care of an elderly spouse, anyone can come in if they've chose to do so and say you're not qualified. She told me I could get hit with a car and have brain damage. Okay? So therefore he needed to be in a home. Well, how many people live together, couples, that have loved ones they're taking care of? And this is a law that's allowed to happen. I had the social worker come to my door. I'm under tremendous stress because of it. I'm emotionally distraught. I'm unhappy. I'm in tears. I'm walking the floors all night. I don't know who's going to come to my door to attempt to take this man who is a veteran. This man fought 2 wars. He fought in World War II, and he fought in the Korean War. And he does not want to leave. He's got a modified home here that's beautiful, that accommodates him in every way. And yet this nurse has this power. Well, I need to go to Congress, and I will go to Congress and appeal to Congress to change that law, that any social worker or child custody evaluator should not be allowed to come to the home and send the judge that kind of information for him to sign. Judges are not trained. It should be with a doctor. There are laws. I'm not a lawmaker, but lawmakers need to be involved, and I will fight that fight. So anybody out there, I'm asking you, I am a non-profit organization. Send me donations. You will get a tax deduction, and I hopefully will get an attorney to help me fight this battle. I don't want to lose my husband, and at the same token, I want to carry this fight to Congress. This is unfair to do to our elderly and the children that have been taken away from child custody evaluations, from custody evaluators that are paid a lot of bucks from certain attorneys, whatever the reason. I don't want to accuse, but I want to tell you, I know this. This is my field. So with that, I'm going to ask you to just follow me around and see my home and what I do to care for my husband, so that you will see that I am qualified and able to take care of my husband. Yet this RN can come in there and say he has to go to a long-term facility. You can no longer help him, because I would not help her the second week at the time frame that she required. I run a business, and if you look around this room, pan the room, please, David? If you look around this room, this is my office, and I treat patients here in the evenings. I treat them for addictions. I've got a 30-day addiction program in place, and I treat difficult-to-treat disorders, and I do clinical hypnotherapy, and my website is www.gaininstitute.com, and GAIN is spelled with an E, Gaine Institute, INSTITUTE.com, one word. You can email me, flood me with emails. Help this worthy cause. Do not allow our children to be victimized, as so many of them have, in the hands of people that are supposedly got this power. It's an abuse of power. And now the elderly victims taking care of your husbands and your loved ones, I am appealing to you also. Please help and understand. All right. Let me show you what I do taking care of my husband so you can see I'm able.